Hydrogen peroxide, a cheap antiseptic, yes, but is it also a powerful tool against respiratory illnesses of all sorts? This query propels us into the intriguing domain of an unconventional treatment method. Nebulized hydrogen peroxide, a method touted by medical stalwarts such as Dr. Thomas Levy, Dr. Mercola, and Dr. Brownstein, is being utilized to combat respiratory infections. This technique involves the nebulization of a hydrogen peroxide solution targeting pathogens residing in the sinuses, throat, and lungs. Intriguing, isn't it? But how does this work, and is it really effective? Let's delve into the benefits of this treatment as touted by the experts. So, nebulized hydrogen peroxide. What's all the fuss about? Well, it turns out that it's been shown to effectively eliminate pathogens. Those are the pesky microorganisms that cause disease in the sinuses, nose, throat, and lungs. That's right, it could potentially clear out the very places where respiratory infections like to set up shop. Now let's talk about a case study that caught our attention. It involved nebulizing colloidal silver, another substance with antimicrobial properties. This treatment was found to significantly improve symptoms in a patient with cystic fibrosis, a condition that affects the lungs and digestive system. These findings suggest that nebulized hydrogen peroxide could potentially be a game changer in treating respiratory conditions. But, as with anything, it's essential to understand the full picture. Sounds promising, doesn't it? But what about the potential side effects? Like any treatment, we must consider the potential side effects and safety precautions. Nebulized hydrogen peroxide, while effective, is not without its risks. Potential side effects may include irritation to the sinuses, nose, throat, and lungs. Overuse or incorrect dilution could lead to more severe complications. That's why it's crucial to take safety precautions seriously. Always use the right concentration of hydrogen peroxide, making sure it is food grade and then diluted to 0.1% using saline. Adding substances like Lugol's iodine or colloidal silver to the nebulizer should be done with caution. Safety should always come first, so how should this treatment be prepared with that in mind? The key to safe and effective use of nebulized hydrogen peroxide lies in the proper dilution technique. When preparing your solution, it's crucial to use food-grade hydrogen peroxide. Next, you will need to calculate the dilution of hydrogen peroxide to 0.1%. The simplest way to do this is to use pre-diluted hydrogen peroxide to 3% and then 1 part hydrogen peroxide to 30 parts saline. When used in this manner, the potential side effects of this practice are negligible at best, with high upside potential for benefiting your health. So, we've delved into the world of nebulized hydrogen peroxide, but what are the final thoughts? As we've seen, this treatment presents promising potential, with benefits ranging from eliminating pathogens to aiding respiratory conditions. However, it's essential to remember that it comes with its own set of rules. The correct dilution technique, using food-grade hydrogen peroxide, and early implementation with onset of symptoms are key elements to ensure its effectiveness and safety. And let's not forget, before embarking on this journey, it's always wise to seek the advice of your physician. What's your take on this? Share your experience or thoughts in the comments below. And don't forget to like and subscribe for more investigative health content.